That's called the vestibule.
Between the cheek and the gum.
Yeah, where you run your tongue around your gums, around your teeth.
Oh, yeah.
That's the vestibule. It's an architectural term. Would you wait in the vestibule while I get the master, you know? Anyway, so. You're gonna be crazy. Yeah, the vestibule. So that's a simple one. If I can't find anything good on the rabbit or the cat, I'll stick a pin in there. Okay, then there's the oral cavity, there's the hard palate, it's hard. And in the cat, it has some ridges on it that, along with these really rough protrusions on its tongue, are used for grooming and and also for rasping meat off a bone. If you're ever licked by a tiger or a lion, it can actually tear the flesh. That's probably your least worry, though, if you're being licked at that point. But
Better make sure your head's not gonna get.
right, yes. So the hard palate in the rabbit, the roof of the oral cavity has these ridges. Okay, it plays a role in their processing plant material along with their molars. And they do not. They have a diastema, a big gap between their incisors and their molars. Okay, the cat, of course, has incisors and then it has canines for piercing, for killing prey and for piercing food. And then they have sharper, scissor-like molars for cutting flesh rather than grinding. Okay, so at the back of the hard palate is a soft palate made of, connective tissue. And that and some muscle and lymphoid tissue. This is where I'll get out the plaque from the 15 Commandments. Remember the movie where Moses comes down from the hill, Mel Brooks movie, and he says, the 15 Commandments, drops one and breaks it. Oops, the 10 Commandments. We needed those other 5. But anyway, so this model is pretty good for a few things on the brain and also the respiratory and digestive tract, because it shows very clearly, here's the hard palate, here's the soft palate. The soft palate divides the nasal and oral cavities, and the back of the nasal cavity is called the nasopharynx, because it's it's part of the nasal cavity. The pharynx is a term we use for what we would refer to as the throat, but it's more elaborate than that. It has 3 parts. This is the nasopharynx. The back of the oral cavity is called the oropharynx. And just to make it simple, we'll say if it's below the soft palate but above the voice box, the larynx, that's the oropharynx. If it's next to the voice box, anywhere from here down to here, it's the laryngopharynx, because it's near the larynx. Now, it couldn't get simpler than that, but believe me, students ask me over and over and over again. Drives me nuts. So it is not rocket science. It's very simple. What part of it is it in? So how am I going to label it? Well, I could use the model, or I could stick a pin in the pharynx. If I put the pin in the nasopharynx, I'm going to really push the soft palate upward, and I'm going to anchor the pin in the skull. And these people still get it wrong. If I want the oropharynx, I'll put it right there below the soft palate, but above the voice box, this cartilaginous box. If I want laryngopharynx, I'm going to open up the side of the oral cavity and cut all the way down the esophagus, and I'm going to put the pin there and say, what part of the respiratory and digestive system is this? And that's the laryngopharynx. Easy. Okay, from the laryngopharynx, if we follow the food tube, the esophagus down, we'll see that it consists of a flat, collapsed tube when there's nothing in it, no food or beverage. It is below the windpipe, the air pipe. So esophagus there, and above that is a thing that looks like a vacuum cleaner hose called the trachea. And I would bet that they modeled vacuum cleaner hoses after this. Those rings are C-shaped cartilages. prevent when they reduce the risk of the tube collapsing when you breathe in and there's a slight vacuum, although they can't. So that's your vacuum cleaner hose. The trachea beneath, that's the food tube, the esophagus. Now the larynx itself, and it's pronounced larynx, not larynx, is a voice box, okay? It's where vocalization occurs. We have vocal folds in there and vocal cords that vibrate and make sounds. And it also is where the digestive tract and the respiratory tract separate. That slit-like opening you see in there, and we will use the cap for this because it has a bigger larynx and more vocalization. I like this one better. This slit-like opening here is called the glottis. That is the connection between the digestive and respiratory tract. When I described in lecture that in early development in the foregut, an opening appears and a little bud called the tracheobronchial bud starts by growing and bifurcating again and again and again, divides. It's going to form the tracheobronchial tree, the respiratory tree. So that's the original connection between the foregut and the respiratory tract. Now, normally, when you're not eating or not swallowing food or beverages, this glottis is open, and that valve-like thing called the epiglottis it's in the up position, so air can flow directly into the glottis, into the voice box and trachea. The esophagus is closed, it's collapsed. So this allows air to go in and out through that slit for breathing and for vocalization. When you swallow foods or beverages, what happens is this lid is pulled down and the larynx is pulled upward, and it blocks off the glottis so that food and beverages are directed down the food chute. But because we are upright rather than parallel to the ground like a quadrupedal cat or rabbit, so gravity creates a problem, and because our whole voice box during infancy migrates